Autism spectrum disorder, a neurodevelopmental disorder. Presentation by Linda Yabuti and Mary McPhillips. The prevalence of autism spectrum disorder is displayed in this graph for the years 2000 to 2010. In the year 2010, the prevalence of autism spectrum disorder went up to 1 in 68 children in the United States. The prevalence of autism is 5 times higher in boys than it is in girls. The DSM-5 criteria: persistent deficits in communication and social interaction, restricted, repetitive patterns of behavior, interest or activities. Symptoms must be present in the early developmental period. Symptoms cause clinically significant impairment in social, occupational, or other important areas of current functioning. Some screening questions for persistent deficits in communication and social interaction. Does your child respond to his name or your voice? If you point at something across the room, does your child look at it? Does your child play pretend or make believe? Is your child interested in other children? Some screening questions for restrictive, repetitive behaviors, patterns of behavior, interests, or activities. Does your child get upset by everyday noises? Does your child try to copy what you do? Does your child like movement activities? Is your child sensitive to textures? Normal development is measured in stages of obtained tasks in physical, communication, and psychosocial development. On the slide, we have the stages of psychosocial development by Erik Erikson. Concerning behaviors to look for: no big smiles or other warm, joyful expressions by 6 months or thereafter. No back and forth sharing of sounds, smiles, or other facial expressions by 9 months. No babbling by 12 months. No back and forth gestures, such as pointing, showing, reaching, or waving, by 12 months. No words by 16 months. No meaningful two-word phrases by 24 months. At any loss of speech, babbling, or social skills at any age. Differential diagnosis: intellectual developmental disorder, global developmental delay. The DSM-5 notes that co-occurring frequently is autism spectrum disorder and intellectual disability. Treatment options: behavior and communication approaches, dietary approaches, medication, complementary and alternative medicine. Behavior and communication approaches. One of these approaches is applied behavior analysis. There are 4 types highlighted in this slide. The first is discrete trial training, which is a style of teaching that uses a series of trials to teach each step of a desired behavior. Early intensive behavioral intervention. This type of ABA is for very young children with ASD, usually younger than 5 and often younger than 3. Pivotal response training aims to increase a child's motivation to learn, monitor their own behavior, and initiate communication with others. Verbal behavioral intervention. FBI is a type of ABA that focuses on teaching verbal skills. The article that we chose highlighted the challenges faced by parents of children diagnosed with autism spectrum disorder. Caring for a child with a diagnosis of ASD has been shown to be especially stressful due to the complexity of the symptoms that characterize ASD. Parents have to deal with several other difficulties while caring for a child diagnosed with ASD. Financial, restrictions on social activities, and spending a lot of time with medical and mental health professionals. Most children with ASD find it difficult to relate to others, understand others, or tolerate the presence of others. They can feel like a loner or be isolated. Children diagnosed with ASD are very rigid. Most parents with other children find the routine difficult to maintain every day and are stressed themselves because without the routine, for i.e. getting ready or school or bedtime, the child will not comply. There are several resources for the community in regards to ASD. The first one is the cdc.gov /ncbddd/autism. Another helpful resource is NIMF.gov. We also found it ScienceDirect.com and WiredHealthResource.net. The following is a YouTube video from Khan Academy discussing further autism spectrum disorder, its signs and symptoms in the DSM-5.